Hello, YouTube. I am coming to you today to speak with you something that I am very passionate about, and that is being an advocate for yourself. And I took notes that way I don't get distracted about what I'm talking about. And don't mind this, I have a pimple. I'm trying to have that go away. So, a little bit about myself. I've been a nurse since 2007. My first job was at an urgent care clinic. I worked as a community nurse. I've also worked as a surgical tech, which means I was in the surgery rooms passing the instruments. I've also done home health for a while. So, being a patient advocate is just something, again, like I said, I'm passionate about. You need to understand what is going on with your plan of care or your body and just understand what medications you're taking. So there are 5 things that I can think of right now. I'm sure there's more. I'll probably do a part 2 because I'm very sure there is more. I know for a fact there's more than these 5 things, but I'm going to give you 5 at a time. So the first thing is make sure that you are very comfortable with your doctor, that you like your doctor. You can speak with your doctor. That is so important that you are just comfortable with them. You can have a conversation with them also. If you do not like your doctor, get another one. I know some people are on Medicaid and Medicare, and you can also request to get another doctor also. Again, you need to be comfortable with your physician. Number 2, make sure you understand what your plan of care is. Plan of care, care plan, same thing. Make sure you understand how to take your medications, when to take your medication, what foods to avoid, what tests you need to follow up on. Make sure you understand all those. If you have x-rays or imaging, MRI, CT, make sure you understand all the information that provider is providing for you during your doctor's visit. Number 3, I recommend that you take notes prior to your appointment. So what I do, because sometimes my brain is in 20,000 places, I will write little notes on my phone. I will use a notepad to write things down. However you want to write things down, write them down. The instructions that he's giving you, the lab tests that he's giving you. Now, I'm not saying Google, because you don't be no Google doctor, because everyone does not like that. But just make sure that you take notes prior to your appointment. That way you don't forget while you're in the appointment. And that way you ask those important things. Number 4, you can take someone with you to the provider's office or to your doctor's office visits. It could be a family member, a friend, a chaperone, a caregiver. Sometimes 2 heads are better than one. So sometimes I'll forget things, but if my husband is there, he'll remember those things that I did forget. Like, oh yeah, he did say that. Oh, that's right, he did say that. Okay, got it now. So you have the ability to take someone with you. And the majority of the time they will just ask, is it okay for us to speak candid with this person in the room? And you say yes or no. Number 5, you know your body better than anyone. You've had your body for 20, 30, 40, 50, 60, it goes on and on years. So you know what works best for you. Now, I'm not saying that the doctor you weigh 400 pounds and the doctor recommends that you lose 200 pounds and you feel like I only need to lose 7 pounds. I'm not saying that. I'm saying, especially for African Americans, lisinopril, it's not always the best blood pressure medication for people of color. So if like something like that happens and that medication doesn't work for you, or you have side effects, speak up. Again, you know your body better than anyone. Ask questions. You're not debating with them. You're not being combative. You're just asking questions, making sure you understand. And again, suggestions. You should feel comfortable bringing questions to your doctor, and you should be comfortable enough to, you should be comfortable enough to discuss things that aren't working and that are working for you. So that was a couple of things that I just think that is so important for people, to be an advocate for yourself. I see it so many times. Some people don't even know what type of medications they're taking or what they're taking it for. I'm going to do a follow-up on this video just to do more, because again, I'm so passionate about this and I see this so often. I will come into a home and the patient doesn't even know why they're taking the medication and when they're taking the medication. But again, subscribe, comment, like, and share. If you have any questions, feel free to drop some in the comment section, and I will get back to you. Okay, you guys have a great day.